Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was: how long should one wait before stopping life support in intensive care on a critically ill patient? You can check out the answer to last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question from one of our readers. And the question this week is part 3 of my 57-year-old dad has been in intensive care with cardiomyopathy and pneumonia for 5 weeks. He's still in an induced coma and still doesn't have a tracheostomy. Help. This series of questions from Gary are excerpts from numerous one-on-one phone and email counseling and consulting sessions with me over a 2-month period. Gary and his family went through many challenges while his dad was in intensive care, and I felt very privileged helping Gary through this difficult time in his and his dad's life. So, Gary writes: Hi Patrick, thanks for your time again today, and thanks for summarizing your answers to my questions. I really do appreciate all your help. I've put a link in the email to the hospital's website that my dad is in, just in case you were interested. They have a 3-bed ICU with 1 procedure room. I've also put a link to the Rate My Hospital website for the hospital, and the rating is extremely worrying. What's next on my to-do and to find out list is what other treatment options there are for the cardiomyopathy, and I hope we can discuss this in our next call in detail. As you've correctly pointed out, they are not equipped, nor do they have the experience to help my dad get any better. Let me know what other options there are so I can present it to them and we can discuss on our next call. Regards from Gary. So here's my response. Hi Gary, the rating of the hospital is absolutely shocking. Just confirms everything that I have been observing and thinking so far. It's good that in this day and age at least the internet can provide a platform for people to voice their concerns and frustrations and keeping the general public informed. The other thing that's worrying to me is the visiting times in the ICU are something ridiculous, from 2 p.m. to 4 p.m. and 6:30 p.m. to 8:30 p.m. That's really old-fashioned and it's highly inappropriate in this day and age. Every ICU needs to be transparent and shouldn't restrict any visiting hours. You always need to ask yourself if they have anything to hide, especially with such limiting visiting hours. I have also written an article and a video about this. What are normal visiting hours in intensive care? And I put a link below this video, and I put below this video in the written version of this blog. Another thing you might want to look at, Gary, is that the hospital does have a social work service, and I believe you should try and contact them. Again, I put a link in there to it. I've also done a quick Google search, and I think that another ICU in your area looks good in terms of their service offering. Again, I put a link to that other ICU in the email. You've got to get your dad out of this ICU. They are going to kill him. Next, as we briefly discussed in our last phone call, now that the tracheostomy has been done, now is the time to look at what else needs to be done in order to get your dad out of this terrible state of affairs. Having said that though, a more optimized sequence of events and treatments should have been: after your dad was diagnosed with the cardiomyopathy, he should have been referred on to a cardiologist, and the cardiologist, in cooperation with the ICU doctors, should have investigated if he was suited to be referred and then transferred to another ICU where they have more advanced treatment options such as ECMO or VAD, which is a ventricular assist device, with then also having the option for a heart transplant if necessary. Given that your dad has now been in a prolonged induced coma for now over 5 weeks, they have missed making this referral to another ICU early on in his critical illness. And again, it screams negligence to me, not even looking into all the other options available outside of their small 3-bed ICU. Again, Gary, 5 weeks in an induced coma are taking its toll, and early interventions such as an early tracheostomy, getting your dad out of the induced coma, would have improved your dad's chances for recovery, and it would have also strengthened his chances to be transferred to a more experienced and better equipped and also more resourced intensive care unit. What do I mean by that exactly? So an early tracheostomy, especially with the worsening cardiomyopathy and the pneumonia, would have reduced the amount of sedation and opiates, which are the painkillers your dad needed, and he would have been in a much better position to wake up after the induced coma quickly. With your dad being out of the induced coma and with the tracheostomy, the focus could have shifted early on to treat the cardiomyopathy and the pneumonia properly. The pneumonia was most likely caused by the cardiomyopathy. So far the focus has been on micromanaging everything that's going on to the detriment of your dad. For example, the prolonged induced coma and the unmanaged cardiomyopathy is now leading to secondary issues such as liver failure and kidney failure. Therefore, your dad is not far away from going into multi-organ failure. Also, with an early tracheostomy and therefore reducing sedation and the painkillers, inotropes could have potentially been reduced as well, as opiates and sedatives make the use of inotropes all the more likely. With the cardiomyopathy being diagnosed relatively early on, and then with your dad needing high doses of inotropes such as dobutamine and noradrenaline, he should have been referred to a bigger and more specialized intensive care unit. And here is why. When cardiomyopathy is being diagnosed early on, the risk to end up on a ventilator and on inotropes is high, especially with pneumonia also being diagnosed. The risk for patients with cardiomyopathy in intensive care is to go into cardiogenic shock, which is what happened to your dad, because his heart simply decompensated at some point. This should have warranted for the ICU doctors and the cardiologists to refer your dad to a specialist hospital, where they could have optimized and also escalated his treatment early on. For example, inotropic support in cardiomyopathy is a first response treatment in intensive care, and if that shows to not improve a patient's situation, other treatment options need to be looked at. This leads me to the issues where I believe they have led you and your dad down. Given that your dad has been unable to be weaned off the inotropes, dobutamine and noradrenaline, the next options would have been ECMO, VAD and the potential for a heart transplant. Again, given that you hadn't even heard about those options for your dad with cardiomyopathy, screams negligence to me. They have kept you and your dad in the dark, and they have withheld crucial information from you. Especially with your dad being so young at age 57, they should have moved heaven and earth early on. Their job should have been very early on to refer your dad to a specialist intensive care unit, so that he would have had those treatment options like ECMO, VAD and the opportunity for a heart transplant available for him. Again, it shows to me that they are not experienced and that they are out of their depth. By giving your dad a tracheostomy early on and by referring him onto a specialist ICU to have more advanced treatment options available for him, you would have been in the best position to get him through this. Now, I'm not saying that referring him to another specialist hospital is too late by now. However, 5 weeks into an induced coma with no advanced therapy options, such as ECMO or VAD, with a view of a potential heart transplant being made available for your dad, are making it all the more difficult and challenging for your dad to access these resources. If your dad gets referred now to another specialist hospital, they'd be asking questions like why they haven't done a tracheostomy earlier, and why they are referring your dad now, and why they haven't referred him 5 weeks ago when he was first diagnosed with a cardiomyopathy. To illustrate this even further, if you have a broken leg, you don't want to see a GP. You want to see a specialist surgeon who can operate on your leg. The same applies to heart conditions. You want to be referred to a specialist hospital and to a specialist doctor that has all the know-how, the skill, the expertise and the access to resources to manage this to get the best outcome there is. Even if a referral to a more specialized ICU was successful now, after 5 weeks of suboptimal treatment limits your dad's chances of a recovery. For example, when critically ill patients first get on ECMO for either decompensated cardiomyopathy or for a cardiogenic shock, it's usually early on in their diagnosis when they haven't been in hospital or in ICU for very long. Given that you are saying that your dad has never been off the dobutamine and the noradrenaline is a clear sign to me that he's got chronic cardiomyopathy, and therefore ECMO, the VAD and potential heart transplant should have been looked at very early on. This is also when ECMO is the most effective, and it can aid as a bridge to a VAD and then as a bridge to a heart transplant. But not telling you about those options in the first place, they have not acted in your dad's best interest, and from my perspective it's simply negligent. With them procrastinating and delaying a tracheostomy, which from my perspective are also a sign that they don't know what they're doing, they're not acting in the best interest for your dad. The induced coma has put a huge, prolonged and unnecessary strain on your dad's already fragile situation. I strongly argue that your dad would have had a fair chance for recovery, adequate therapy in another ICU, and they're playing on your inexperience by trying to distract you from the real issues. But I also believe that they are inexperienced too. I don't believe that they value your dad's life, nor do they respect your wishes, and I think it's disgraceful. Again, Gary, I would be very happy to talk to them over the phone or Skype. However, I also understand that they are very reluctant to look outside of their mini 3-bed ICU. All I can say again is that it's disgraceful and embarrassing in how they are handling your dad's case. It's negligent. I hope this helps, Gary. We will discuss this in more detail on our next call. I've also recommended 2 more ebooks for you, especially now that your dad's got a tracheostomy. You might want to check out the 7 answers to the 7 most frequently asked questions if your loved one requires mechanical ventilation with tracheostomy. And the other ebook that I recommend is Follow This Proven System to Avoid the 3 Most Dangerous Mistakes You Are Making But You Are Unaware Of If Your Loved One Requires Ventilation with Tracheostomy in ICU. And I put some links in below this video in the written version of the blog. So we'll talk again tomorrow, Gary, and we'll talk then. So, how can you become the best advocate for your critically ill loved one, make informed decisions, get peace of mind, control, power and influence quickly once your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast once your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know once your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone or via email by clicking on the products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.